Hello everyone, welcome to Pediatrics by Dr. Anand. Such a beautiful day today. So what is the topic of choice today? Today's topic of choice is amazing. We're going to talk about a topic known as measles. Yes, very importantly measles, the topic of choice today. So what are the top class points we know about the measles? If a patient comes to OPD, what are the three important things you should know about measles? Remember the mnemonic C, C and C. I'll repeat again, 3C are very important, C, C and C. So what is that? Number one, very important, cough, coryza and conjunctivitis. The three important points of measles, 3C, remember, that is cough, coryza and conjunctivitis. This is how the patient will come. Now very important last year PYQ, what type of conjunctivitis do you see in a case of measles? Do you see purulent conjunctivitis or a non-purulent conjunctivitis? Please remember, in measles you have purulent conjunctivitis. But now the question is, where do you see non-purulent conjunctivitis? Non-purulent conjunctivitis, it is seen in Kawasaki disease, last year PYQ. So if the patient comes to OPD, you will ask for cough, for coryza, for conjunctivitis. Very importantly, how the rash will start. Measles is a disease where the rash will come, fever with rash on the day 4. Yes, exactly day 4. And how the rash will come? The rash will start behind the ear. As you can see in the picture, the rash will start behind the ear, then the face and then the body. So that's how the measles rash comes. Now three important last year PYQ. What is the most common complication of measles? The most common complication of measles is otitis media, which is the most commonest cause of death in measles. The most commonest cause of death in measles is pneumonia. And what is the late complication of measles? The answer is SSP. What is SSP? Subacute sclerosing panencephalitis. So these are the three important points regarding the measles. Two important questions. What is the pathognomic sign of measles? In a case of measles, you see very important cells. The picture is in front of you. That is Warthin-Finkelday giant cells. I'll repeat again. Warthin-Finkelday giant cells. They are the multinucleated giant cells. And what is that spot do you see in a case of measles? Yes, bang on answer. The answer is Koplik spots. Koplik spots is something you see in a case of measles, which is seen basically opposite to the first and second molar, small whitish